everybody's very excited.
Good morning, everybody. I'd like to call to order the Public Health Committee meeting for, am I really loud? I sound really loud. For Wednesday, February 22nd. Clerk, please call the roll.
Juby.
Here.
Silva.
Silva's here.
Tarver.
Tarver's here.
Williams. Young.
Young here.
Sanchez.
Sanchez present.
Strathman.
Strathman here.
Huron. Tepe.
Tempe here.
Yipcar.
Okay. I'd like a motion to approve the minutes from January 18th.
Silva moves.
Silva
Tarver
moves.
seconds.
Who was the second?
Tarver.
Thank you, Mr. Tarver. Okay. Clerk, please call the roll.
Juby.
Yes.
Silva.
Silva, yes.
Tarver.
Tarver, yes.
Williams. Young.
Williams, yes.
Young.
Young, yes.
Sanchez.
Sanchez, yes.
Strathman.
Strathman, yes.
Passes.
Okay, the monthly financial reports are attached. Anybody have any questions about them? Did you take a look at them? Questions? Okay. Any questions? Then we'll go on to public comments. And we have Mr. Avalar here this morning. Mr. Avalar, is this on agenda?
No. I will not need even 3 minutes.
Okay. thank
Good morning. Thank you, Madam Chair and members of the Public Health Committee. Two items I wanted to bring to all of y'all's attention. I am speaking in an official capacity as the president of the Dundee Township Mental Health Board. First one has to do, as all of y'all may know, last Friday was the deadline for filing legislation for the spring session in the Illinois General Assembly. And one particular bill that I want to make all aware is numbered House Bill 3350. This has to do with domestic violence and its possible inclusion of coverage within the Community Mental Health Act. Whether this bill will go anywhere this session, we do not know yet. But if it does, and it does become law, it will definitely have an impact on mental health boards across the state, let alone within the 11 here in the county. I would ask that if indeed it does pass it, because for a mental health board to add domestic violence, the governing boards, whether it's the townships or the city councils, will have to go to referendum to ask voters to approve the addition of domestic violence along with substance abuse, mental health, and disabilities. What would happen there is that if we don't have metrics, and I'm looking at the project for the Community Mental Health Survey, which is taking place, and I've already asked Director Isaacson if that could be added. So the mental health boards would have metrics if indeed this became law for domestic violence, and how that would impact their scope. And obviously we don't want to do it from a risk and make it a negative impact, but certainly if the opportunity is there, if the Public Health Committee and the county can oversee, including those kinds of metrics, that would prove very helpful for the mental health boards if indeed this becomes law. And then we have to make a decision in 2024 to go to referendum. So I just want to bring that to all of y'all's attention. I also look forward to Director Isaacson's update on the Community Mental Health Survey project and part of iPlan, and we'll look forward to listening to it all. Thank you so much, and welcome back, Director Isaacson, from your Washington, D.C. travels.
Thank you, Mr. Avalar. Okay, we're going to turn it over to Director Isaacson and get some updates here.
Great. Good morning, everyone. Wait a second for the presentation to come on. So the trip to Washington, D.C., I'm very thankful to Congressman Foster's office for that once in a lifetime experience. It was really exciting. His office, they were fabulous hosts, and being able to be there and see the State of the Union address in person. I'm a big history fan and really interested. I love going to DC and spending time there and really being able to be in the rooms where all of these great conversations, great and not so great, some infamous conversations have occurred in the history of our country. And then watching things unfold as we're still living it was really quite an opportunity. So we, excuse me, we have a lot on the agenda today, so I'm going to keep my comments relatively brief. Just a quick update on where we are with COVID. So each month I typically will highlight how many cases have been reported to the health department on average each day over the past month. So you can see here we're at our February meeting. Over the last 30 days, we've averaged about 56 cases per day. At the January meeting, we were reporting 95 cases per day. And at the December meeting, we were reporting 111 cases per day. So we're seeing a decline. Same caveat that I always include, where these are only cases that are formally reported to the health department. But the good news is we are continuing to see that reduction. One thing I will note, though, is we're still seeing 2 or 3 people dying each week. On average, it's between 1 and 5. And if we maintain that rate, that still would be the 5th leading cause of death if that continued over the course of a year. So even though our deaths are staying relatively low, that it's still having a big impact on people. So we do encourage people to stay up to date on their vaccines. Can't encourage people enough if they have any kind of bug to stay home. And again, there's a lot of flu and colds and other things. Nobody in your workplace wants to be around you. I know everybody doesn't have paid sick time and everybody doesn't have the opportunity to work remotely. So I don't want to make a blanket statement, pretend it's easy for everybody. But if you can stay away from people, that's much more ideal. And then things like washing hands, increasing ventilation. And if you're around somebody who may be at risk, or you yourself may be at risk, wearing a face covering is still something that's very helpful. I do want to mention, as I talk about the 2 or 3 deaths each week, I hear in conversations with people that sometimes people will say things like, well, you know, a lot of times these are people who are going to die anyway, or if you have COVID and you were in a car wreck, they count that as a COVID death. So I just pulled the death data for Kane County for the past 10 years. 2017 to 2019, we averaged just over 3,300 deaths per year. And then in 2020 and 2021, we averaged over 4,000 deaths per year. So an extra 700 deaths each year. So just to point out that this isn't just people dying of another reason, or people who maybe were going to die anyway this year and they just happen to have COVID. These are extra deaths that we're seeing in our community, and we're still seeing them. So even though I'm thrilled to be walking around and going to parties and seeing people socially and all of those great things, just like influenza, this is something that should be taken seriously as we move forward. Yes, ma'am.
That is like 5th cause of death. Is that statistic state or federal, or?
That's Kane County.
Kane County. Okay,
Yes.
Thank you.
And that's just generalizing. If the numbers stayed consistent with what they were in 2021 is what I'm comparing it to. And we don't have all the 2022 data completely compiled yet, is why I'm using 2021.
Thank you.
And then did want to mention that we do have a clinic coming up at the health department in Aurora on March 7th from 2 to 5:30. I'd look to Director Barrett. Anything you want to say about the clinic?
No, we have all the vaccines available for all ages. That is the Novavax, which is sometimes hard to find for those who are still interested in those, along with the Moderna for all ages, and for the Pfizer. And both the monovalent and the bivalent for the boosters are all available, except Novavax, of course, which is only a monovalent.
Of course, COVID is not the only respiratory illness that's going around. So just for comparison, I like to share this chart. This is part of our flu report that comes out every week. When you look at influenza-like illnesses, you can see, just to kind of orient you to this slide, the kind of light blue that was the big peak over towards the left. Now we're kind of in the middle of the pack. You can see 6.5% of emergency room visits are now influenza-like illness. So again, as you remember, we started off with flu, and we had COVID, and we had RSV. We had a lot of things going on in the fall. Then it dipped down. Now we're on a little bit of an incline, but it's still relatively moderate. So just for comparison, and is everybody getting the flu report? That's something I wanted to ask. Does this sound familiar? Because otherwise we'll make sure that everybody is getting it. So, okay.
I think so.
I don't know that I've gotten it.
No.
Okay, we'll,
I don't think
it doesn't sound familiar. Okay, well, we'll make sure then that we update our distribution list to make sure you're all getting that.
Thank you.
Because I know once a month is hardly enough to learn about this. Every week is much more fun.
Madam Chairman,
Yes, Mr. Tepe?
Michael, you said something about the clinics. How many people do you typically get to a clinic like that?
So this is Laura Barrett from the Health Department. Right now, we're running about 5 to 7 in a period of time, and that's with about 30 to 50% canceling within 24 hours of what they registered. So that's our end of how many we're actually seeing. It is just so available at doctors' offices and the pharmacies that we're offering it to have that still available for anyone. We offer it to all of our children coming in for the immunization clinics every Thursday when they come in with the young children. But it's just so available at so many places that we just haven't really seen the demand. We don't have any phone calls requesting anything at this point in time.
That's why I was asking, is that something that, you could put on in Elgin or St. Charles, or does Greater Family do that in Elgin or?
Yes, all of those. All of those are doing it, and all of them have it available and have it, all our federally qualified health centers provide this and have this available at all their visits in there with it. And like I said, with the pharmacies and locations, it's just so widely available right now.
And I think that the waning interest is pretty much seen at all the community clinics where it becomes less of a return on investment for anybody, whether it's the health department or the clinics, to be out in the community offering these, because you may only get a couple people who show up, as Director Barrett said. So moving on to just some updates around behavioral health. So of course, a couple weeks ago, the full county board passed a resolution with us accepting this new $300,000 grant from the National Association of City and County Health Officials. And this is to embed peers in emergency departments. So we're actively working with community partners and our emergency rooms. And what we're doing is this is an evidence-based way where if someone overdoses and they come into a hospital, we can link them up with somebody who has lived experience. And that's shown to be much more likely to encourage somebody to seek treatment. As part of this work, we're also looking, there's proven medications that can be given to people if they have an opioid use disorder that can reduce or eliminate the effect of opioids. So we're also trying to initiate that. There's a lot of barriers to this. Stigma is still an issue. It can be frustrating for people. I think we've talked about this before. If you see the same person multiple times, if you're saved or revived with naloxone and you come out or Narcan, you're not necessarily in the most pleasant mood, which if you think from the caregiver's perspective, that can be frustrating for them dealing with somebody who may come out and be belligerent. So we're doing a lot of work to try to make sure we have that continuum of care so that if somebody comes in, there may be a provider who's less likely to do all of the steps because they may not feel that the person's going to complete the loop. And so that their efforts may not deliver anything. So far, this project just started February 1st, but we've been doing this work previously with the hospitals, but now we have some additional funding. Elgin Community College has one of the 11 programs in the state of Illinois with peer recovery folks where they prepare people for this certification. So that's an exciting partner. And then the Gateway Foundation is an organization that is in about 27 hospitals around the state. They've been in Sherman Hospital since late 2019. So we're building on some of that successful work that's happened as well. So we're really excited about this project. Again, we're one of 5 health departments in the country who's working on this project. So we also have the benefit of working with the 4 other peer health departments around the country and learning from their experiences as we move forward. Also, I've just been appointed to the Illinois Opioid Remediation Advisory Board's Medical and Research Working Group. So what this is with the funding that's coming into the state, via lawsuits against the pharmaceutical companies. There's a lot of money coming in, and this is a long title, but the Remediation Advisory Board is helping to decide where that funding goes. I'm not on that board, but I'm on one of the two working groups. They have one around health equity and one around the medicine and research. We just met yesterday, and we're making recommendations to the advisory board for where funding should go, what types of things should be supported. And thus far in our conversations, it's things like working with emergency departments and working with jails, which I'm very excited to say here in Kane County, I think we're ahead of the game in both of these areas. We have Sheriff Hayne has been very proactive with this, working with the incarcerated population. Again, trying to make sure we don't have people coming back, making sure we can get people access to treatment, job training, all of that kind of thing. And then with the work that we're doing with emergency departments, that's exciting too. So I'll keep you up to date as that working group continues, but I think it's a good opportunity. And this funding is going to be coming into Kane County for many years. There's multiple lawsuits with different timelines, but I think there's going to be a lot we can do with this funding. Any questions about the opioid work right now? And then, of course, you just voted also on grants that the health department gave out to the community. We gave out about $260,000 worth of grants using grant funding that we had received from the state to our community partners. So there's a lot of exciting projects there as well.
Madam Chair.
Ms. Combs?
Just on that note, I would like to thank you for last night's efforts in St. Teresa's. We're one of the food banks with Loaves and Fishes. Kane County Health Department was a partner with them, and we gave out some extra things. So thank you very much. I
Nice.
appreciate
Very
it.
good.
Very nice.
Looking at mental health, we just had a very successful Youth Voices Forum. And this was split into two separate days. One, again, glad to have COVID slowing down a bit. So we actually convened young people from 8 high schools in Kane County. This year we met at Elgin Community College. Chairman Pirog was there and was able to give some opening comments and talk to the youth. This is not open to the public. This is for the young people and the staff from their schools to get together and talk. We'll share much more information about this next month because we're just compiling all the information, and we actually create a report each year. This is the 4th year that we've done this as part of our what we call system of care. Youth voice is a very important part of that, to see what young people are thinking and what they have to say. So we did the one day where we had the young people in person, and then we had a separate day where it was open to the public, and we had young people and staff from the schools who were on a panel, and we had over 100 participants who joined to hear what the young people had to say. So that was really exciting. These young people are very impressive with how they carry themselves and really what they're feeling and what they're seeing in their experiences. So again, stay tuned. Next month we'll have hopefully we'll have the report. We're using next month's meeting as kind of a driver to at least get a draft of our report done, which will have formal recommendations for different sectors, how we can better support young people. And then also Thrive by 2025, which is a way to pull all of these different things together. The planning for that continues. The Behavioral Health Council is meeting this afternoon. The Opioid Task Force is meeting on Friday. We have multiple groups, and as Mr. Avalar mentioned, domestic violence, all of these things go together. And mental health is really, as Mr. Kenyon and I were talking, mental health is the foundation to a lot of things that we see in our community. And there's a lot of other things that are going on that are foundational to our mental health. So including poverty, access to care, social media, trauma that people may be experiencing, including violence in their homes. So all of this, it's complicated, but it all fits together. The Thrive by 2025 is an effort to get in one place. How are we partnering with our friends in court services and in law enforcement out in the community, hospitals, social service organizations? We talk a lot about housing. We talk a lot about hunger. These are real issues that have an impact on people as they're growing up that can impact their mental health negatively. So we need to keep that all in mind. And then finally, we did receive notification that we received the $160,000 grant from the Illinois Department of Human Services for gun violence prevention. So It's a great crowd today. It's great. Yeah. So that's very exciting. So again, if you weren't here, the state, as part of their reimagined public safety work, picked certain communities around the state based on rates of gun violence. Aurora made that list. It was the very last city on the list with the lowest rate, but it made the list. And thank you to Chairman Pirog. We were very proactive and have been involved in this almost a year. I think it was March of last year, where we started actually hosting and convening these meetings in Aurora, working with the city and the police department and all of the providers in the community. So now this funding is going to allow us, actually, there's a resolution on the agenda today. This is going to allow us to actually hire somebody to continue to coordinate that work, which is what this grant was for. And then there's also a couple of other grants, some that we haven't heard yet, where community partners, we worked with them to provide technical assistance for them to apply, because a lot of our organizations that do street outreach, they don't have the same capacity that say the health department has in terms of jumping through the hoops of filling out all the grant applications and things like that. So we try to provide as much support there as we can. So very exciting. We don't have a contract yet, but this will be something that is, we have the notification, and the state's usually pretty good at getting us the contract. So stay tuned for more on that.
Sounds like you've been really, really busy.
There's a lot of great things going on. We have a great team at the health department. We have been very busy. And we'll have a demonstration in a few minutes. I wanted to acknowledge Katie Griffiths from our office, who's our emergency response coordinator, who's been partnering with the sheriff's office and Sherman Hospital, providing the CPR, which has been hugely successful for February being Heart Month. We really wanted to get out there and get as many people trained as possible. I'll keep my comments to just that, because I don't want to steal any of Nikki's thunder. And then another pretty exciting thing we did is we convene people who do home visiting programs. So we have our own home visiting program, but we also help to coordinate other home visiting programs. So I don't know, Director Barrett, you want to share a little bit about this?
Yeah, we work with a mental health consultant with this group, and this last month at the end of January, right here, right below us, right here in auditorium area in building A here, we held a first in-person meeting since COVID, of course, and had over 52 home visitors from throughout the county come join us for a moment for them to take some time to take care of themselves, but also then to help and how they're working with their clients, which, if you remember, those home visiting clients are ones that are the prenatal all the way up through the child's third birthday. They are usually experiencing some type of economic, social, mental barriers that they're having challenges with. It could be substance abuse or use. It could be domestic violence. It could be any of those type of low education, any of those type of concerns they might have. So that team needs that little help to take care of themselves a little bit once in a while. And this was a great program for a couple hours that we took some time out to meet together in person and get some great networking together. So it's a great program.
And for the newer board members, if you haven't heard us kind of beat this drum, home visiting is one of the most effective interventions we can do. So as we look at how do we really support families, home visiting programs are a great way to support somebody, especially some of our programs are for first-time moms. But this is something, if you want to avoid community violence 15 years from now, home visiting is a way to do that. So there's clear evidence that families that have that support, that have somebody coming in and helping, that's going to have an impact later in life for those young people, because we're just creating a more supportive environment. So you'll hear more about home visiting as we move forward. And then we have a slew of resolutions. So again, I kept this pretty brief this morning, but happy to take any questions.
Are there any questions?
Madam Chair.
Yes, Mr. Linder.
With the youth voices, you noted that there were 8 high schools involved. I know we have more high schools than that. Have some declined, or have we just not reached out to all of them?
No, we definitely work with all of the high schools. I think in some cases, people are still getting through COVID and the schools are getting back to normal a little bit. We're pulling people together in Elgin. Some maybe transportation may have been a barrier, but we do try to move it around each year. So it's a little more equitable. And we did have schools from Aurora who came up. So our farthest south schools still were able to
The
participate.
Tri-Cities here?
We had some from the Tri-Cities, but not all.
Okay.
But again, even the schools that didn't participate in the forum by having kids come, we worked very closely with their staff on an ongoing basis.
Thank you.
Yes.
So I
Ms.
have
Stube.
two things with that. One is, because I was on the other side of it when the kids were being picked for Youth Voices, they're screened by their counselors. And so not every school has people that they think would be good to attend. So that's a lot of the problem as well. The other thing isn't that the Zoom that they did the second day, isn't that available on video? I thought it was sent to me. So maybe could we get
Yeah,
that to everybody? Because it was fascinating to see. This was a really good one. Josh did a really good job moderating it and everybody felt really comfortable. And so they were a lot more candid in this presentation than the ones in the past. And then my question actually is one of the, you're doing the violence prevention coordinator. What does that job look like? Like what, and who do they spend their bulk of the time reporting to? And I mean, I think it's amazing. I just don't know what it looks like in this context.
Sure. So well, first for the Youth Voices Forum, I will send a recording of that out to everybody. You mentioned Josh, so just a couple of quick shout outs. So Josh from the Regional Office of Education served as the moderator for the second portion. He did an excellent job. Kate McCormick from the Health Department is very active, involved, and is the chief planner for this event. So they did a wonderful job. So I want to acknowledge them. In terms of the youth violence coordinator, this is a position where we're really looking at coordinating the services. So this person is not doing street outreach. This person is not working directly with youth. Rather, this person is working more at a systems level, working with the different providers, interfacing with the different folks in law enforcement, different folks with social service providers, youth engagement, et cetera. So the type of person that we're looking for is somebody who's going to be organized and has an understanding of how these systems fit together. And then obviously this is complicated, complex work. This is, there's different feelings. And I certainly saw it at the State of the Union address. Policing is in a tough place right now because I think that there's a lot of people who are speaking up about police violence. And then also on the other side, people are saying this is a very hard time to be a police officer because we're seeing an erosion of support in the community. We need somebody then who can come in and work with organizations to say, okay, we get it that there's a lot of different impressions and there's a lot of different experiences that people have across our community. And we need to figure out how we can bring everybody together to work, because what we're ultimately trying to do is to reduce violence in our communities. So it can't be somebody who's I'm 100%, pro police and I don't care what these people say. And it can't be somebody who says, well, I'm 100% community. And so, I don't care what the police say, because we certainly do hear both of those sides of things in these conversations. It's got to be somebody who can work together with all different people. And I'm just using police and communities examples. There's a lot of other partners we need to engage in this too.
Madam Chair.
Yes, Dr. Silva?
Thank you. And along those lines, I think it's also important to visualize somebody who understands the language that is used not only commonly now socially, but also with the different generations, because I hear directors saying that, somebody has to be somebody can't be 100% police or 100% community. Well, to some of us, that's kind of a contradiction, because we can be 100% police and we can be 100% community. So it really has to be somebody that as part of that mitigation of aggression or of passion, let's call it passion, because we all have a lot of passion when we believe in something. It has to be somebody that can use the language that would be used across generations and across social and economical understandings. So I think what I'm being very wordy, but what I'm trying to get across is this person would have to understand the nuances of different generations and how folks talk nowadays, because like I said, to me, I'm 100% both, but somebody who might not understand from a different generation might say, well, what do you mean you can't be 100% community, but yet I'm here and I'm, and I care about the police too. So I think that's a very important point that we can kind of bridge the language, I think. Thank you.
And I should point out, thank you, Dr. Silva. Dr. Silva and Commissioner Molina have both been very active in this work with this Aurora group. So I appreciate their input, and yes, excellent comments, Dr. Silva.
Any other questions?
That concludes my comments. Thank you.
Okay, all right. So we do have in front of us this morning some resolutions. The first one is authorizing the acceptance for fiscal year IDPH COVID-19 vaccination grant.
So this there's a lot of grants that have the word COVID in them, because obviously there's been a lot of money that has been initiated because of COVID. So this is a new grant that we're receiving, $500,000. This is going to support not just COVID, but really how we deal with a lot of different infectious diseases. So this is really helping us with our infrastructure and public health. I don't know, Director Onwuda, anything else you want to say about this grant, or Director Barrett?
Yeah, it's going to be a wonderful opportunity for the county to help with multiple immunizations, so monkeypox, childhood immunizations, along with COVID.
So it's pretty straightforward, more
So
money that's going to help support our ongoing efforts.
yes, when we use COVID as a learning situation, we can learn a lot. So I'd like to have a move on this resolution. Anybody?
Sanchez moves.
Sanchez move, second.
Silva seconds.
Dr. Silva, thank you. Okay, clerk, please call the roll. Are there any questions? Okay,
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams. Mr. William? Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
passes.
Thank you. Then we have another resolution. I'd like to have a move and the second and possible passing of resolution. This is, wait, I have the right page here. Authorizing the workforce development intern hiring.
Sanchez moves.
Sanchez moves. Do I have a second?
Young, second.
Thank you. Any questions? Mr. Isaacson, you want to tell us a little bit about this?
Sure. Just we have a grant right now that allows us to pay interns and staying in compliance with the county's policies around paid interns. We actually need to make them employees. They aren't contractors. They are actually just temporary employees. So we simply need to be able to increase our headcount. As with any resolution that we have that involves personnel, any headcount increases that we have, especially if it's grant funded, it's always made very clear that the position only lasts as long as there's grant funding. In the case of internships, it's limited to the time of the internship. But just as a general statement, so everybody's aware, if we're increasing headcount, it's based on available funding. So.
Okay. Clerk, please call the roll.
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver. Mr. Tarver. Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Yes.
passes.
Okay. We have another resolution this morning. I'd like to move on the resolution 23-264. And this is authorizing the health department the purchase of mosquito larvicide. Do I have a?
Sanchez moves.
Sanchez moves.
Juby, second.
Juby seconds. Mr. Isaacson?
Sure. In terms of West Nile virus, larvicide or killing mosquitoes when they're in the larva stage is the most effective way to limit the amount of mosquitoes that there are. So this is something that we bring to the board every year to purchase this. I don't know, Director Onwuda, anything else you want to say about this?
Yeah, like Director Isaacson said, Can you hear me now?
There we go. Yeah.
Yeah, this is Uche Onwuta, Director of Health Protection. Yes, larvicide is important for keeping the mosquito population down, especially in the summer. So we come to the county board every year to get it approved since it's over $30,000. But this is pretty typical for normal West Nile virus control.
Okay, any questions? Okay, clerk, please call the roll.
Juby,
Ruby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Stratman,
Yes.
passes.
Okay. We have another resolution this morning, which is authorizing personnel hiring in King County Health Department epidemiologist. And this is resolution 23-265. Mr. Isaacson, you want to tell us about this?
Sure. So we do have grant funding from the Illinois Department of Public Health to fully support this position. As we've talked about on an ongoing basis, and when I was hired into this job, and I think even to comments Mr. Avalar was making, we need to get more information out to people. We need to be able to analyze information better. We currently have one epidemiologist who is working in non-infectious disease work. We have one who works in infectious diseases as well. For a community of over 500,000 people, this isn't enough to get the work done. So this grant from the Illinois Department of Public Health is going to allow us to increase our capacity so that we can get information out. This is targeting opioids, but really it's looking at all the risk factors for opioids too. So I think as we talk about domestic violence and things, as Mr. Avalar said, this is a way where we're going to be able to get each of you better information about what's going on in your community, and it's going to help us better plan our programming.
Any questions?
Yes, I have a question. So,
Mr. Young?
yes, thank you. David Young. Mr. Isaacson, epidemiologist, they study infectious diseases, right?
Or it could be violence or illness or accidents. Yes.
Oh, because when I looked up, it was just simply the study of diseases.
Yes.
So
things that
it's-
impact health.
So it means something more than just that.
Right.
Okay. Okay. Thank
I
you.
think traditionally in the history, just a 10-second kind of public health view, we talk about there was a Dr. John Snow and removing a handle from a water pump where people were getting cholera. He's kind of the father of epidemiology. So it really started infectious disease. But over the decades, especially with vaccines and things like that, we've really looked at obesity and smoking and things like that, where our epidemiologists are very engaged in that work as well.
I did not know that because the way you're describing it, it would sound more like a position for, someone that is involved with more like social work than someone studying infectious diseases. Like I had thought that was the traditional definition. Okay.
Madam
Okay,
Chair comes.
Yes. Ms. Combs.
Mr. Young, I had the same problem as you did, and I dumbed it down for myself. Epidemic, domestic epidemic, gun epidemic, you know what I mean? Like, and I had the exact same thoughts as you did, so.
Then we need to make sure Wikipedia changes their definition.
Right. Yes.
Well, let's add it.
Get on that. would you
Madam
please?
Chair, Silva,
Yes, Dr. Silva.
I think of it as sort of keeping track of disease in order to control it, and whatever factors are involved in keeping track of this disease, social, economic, physical,
Absolutely.
in order to keep track of it so that we can keep it under control. That's how I think about it.
Absolutely. Yes, Mr. Sanchez.
Thank you, Madam Chair. This is in addition to the epidemiologist we have on staff.
That's correct. This will be adding one. Yes.
So this makes two.
This makes two that are
Okay.
not focused
Okay.
exclusively on infectious diseases.
Okay.
We have one who stays plenty busy with infectious diseases. Ms. Onwuta.
I can actually speak on this because I'm a trained epidemiologist. I have an MPH in epidemiology. And what epidemiology is the study of what is upon us. So if it's infectious disease or it's cancer or it's environmental health, I studied epidemiology of environmental health, epidemiology of cancer, epidemiology of whatever that is upon us. So it's just being able to tell what is the difference between normal and what has suddenly happened. So yes, there's epidemiology of opioids too.
Thank you. Any other questions? Okay, clerk, please call the roll. Yes, Mr. Sanchez moved and Mr. Young seconded, is that right?
No, I don't think we had a.
Okay, I'm making it up
But
then.
that's fine.
All right, Mr.
So moved.
Sanchez, will you move? And
Seconded.
I'll second. Yes.
thank you. It was a premonition.
Juby,
BI.
Silva,
Silva, yes.
Tarver,
Carver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman.
Strathman, yes.
Approved. Passes.
Okay, we have another resolution this morning. And this time we will ask for a move in a second. So possible approval of a resolution hiring a violence prevention coordinator for the Public Health Department.
Sanchez.
Carver moves.
All right, Sanchez moves, Tarver seconds. Mr. Isaacson.
I think we spoke to this one, so this is the new grant funding and to help coordinate these efforts.
Great. Okay, any questions?
What would this individual?
Mr. Young?
David Young, Mr. Isaacson, what would that individual do? You said coordination, but what is that exactly?
So it'll actually be hosting conversations, again, with a focus in Aurora, but we think there's going to be benefit that's going to spread throughout the county, where they'll be working with law enforcement and working with other organizations around violence prevention. And again, I'll start with the root causes of these things, where we look at early childhood trauma is something I mentioned. Home visiting is a prevention intervention. So they'll be working across the continuum. So looking at what's happening with families in the community, looking at kids who are potentially gang involved, looking at peer mediation, looking at all these things, but at the system level. So they're not going to be necessarily the ones who are going in and providing the direct service. Rather, they're going to be helping to coordinate with the organizations that are, which is very much actually our model for many of the services that we do.
So that would also include where you said working with like with the
Mhm.
sheriff's office
Mhm.
and mental health. And so they'll identify a particular problem and then
Mhm.
bring a different department in to help with that
Exactly.
situation.
Yes.
And this will be a day-to-day,
Yes.
hour-to-hour
Yes,
occurrence.
and with a lot of things, I think it's at least to me, and this is subjective, but I think it rings true. There's a lot of coordination that we just maybe from the outside think is occurring on a regular basis, when in reality, people are busy doing their jobs. So the police department is very busy doing their work, right? So the youth development people, they're focused on doing that. One thing that we do as public health is we come in and we can convene people, and we can help to arrange and kind of sit back and help with them do some of the thinking and identify opportunities for how we can do things differently. But a role like this provides somebody who has that extra space where they can engage in those types of conversations, look at what best practices are from around the community that somebody, say, at a police department may be perfectly capable of doing, but they don't have an extra 30 hours a week to do it. So this is going to be that extra support for all of our community partners.
And this person will report to you?
It'll report to our Director of Community Health.
Okay.
Yes, Madam Chair?
Thank you. Is this on? It is on. Thank you. And I just want to speak on that behalf. This director and the whole program is proactive rather than reactive. Oftentimes we'll find the police department, health department is reactive to an opioid crisis, a gun violent incidents, et cetera. What this program does is take it from the top and redirect, teaching our youth, literally our youth from about 9 to about 16, who are at that critical age to learn to make good judgment calls and not to have negative influences upon their life, how to mitigate those, how to redirect that energy into things that are perhaps more appropriate. So that's what this individual is going to be doing. And that's what all the programs are working towards, to stop the gun violence.
An ounce of prevention is worth a pound of cure. And cheaper.
Right.
It's always cheaper. So, okay. Clerk, please call the roll.
Juby,
GBI.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Yes.
passes.
Okay, our last resolution this morning is for the support of and goals and ideals of National Public Health Week, which is coming up. So, Mr. Isaacson, you want to tell us about that?
Sure. The first full week of April of each year is National Public Health Week, just with the timing of when the board meets. We'd like to see this go to the March county board meeting so that prior to Public Health Week, the county board can vote on this. This is really to acknowledge all of the hard work that primarily for me, that the team at the health department is engaging in an ongoing basis. But of course, because public health is spread over many sectors, it's how we all work together. So it's just looking at all of the work that our community partners are doing to support the health of the public, and for this week, just bringing special attention to it. So this is some language that's taken from the American Public Health Association, whittled down to really focus on some of the key health issues that we've worked with here in Kane County. But ultimately, it's just to acknowledge the great work that people are doing.
Oh, we certainly want to do that. Yes, Ms. Juby?
So I'd just like to share something because I think that we all bring different lenses to the table. I've been a member of the Mid-Valley Special Education Cooperative for years, and we just had a meeting at the beginning of February. And I wanted to share 5 very sobering takeaways from our last meeting. I thought this was an appropriate time, seeing how we're talking about mental health. This group predominantly deals with students, school-age students and their families. So there is that kind of slant to it, but providers are seeing the need for mental health supports earlier than pre-pandemic. They're seeing them. The largest growth area is pre-kindergarten to 2nd grade, which is very terrifying to me. And that they're finding that their average 8-to-1 wait list. So 8 students from the pre-K to 2, as opposed to 1 student from the middle school, high school level for the providers' wait lists. The behaviors are more aggressive and the students are more dysregulated. There's more refugees with mental illness needs, homelessness needs who do not speak the language. So it's incredibly hard for them to seek support or actually get the support. Many parents are unaware of the resources that are available. They don't know how to access them. They don't know that they're there, and they can't get them for themselves or for their children. And that there's a lack of affordable nutritional food, which leads to the greater mental and physical health needs. And I just thought it was really important because when we talk here, we talk very globally, but we're talking pre-kindergarten students. And if there's anything we can do to partner, I know we do a lot through IRIS, and I know that there was a lot of talk about that. And I bring that up every meeting that we're there to help people, because there's always new people there that don't understand that there's somebody there working on the whole person in the community. But if there's something we can do, this was scary to me. And like I said, I've been part of this group for a long time. I've walked away being concerned. This scared me. Thank you.
Thank you. Wow. So that's some sobering,
It's very,
sobering news there.
yeah. But the good news is they're being helped where they can be, but one person isn't as effective as 300. So, if there's a way we can really reach awareness and maybe expand into other areas just to get the awareness out there, because you guys do a great job when people know to go to you.
Right.
Right.
Yeah.
Right.
Madam
We all
Chair.
have a role to play in that too. So,
Madam Chair Gums.
yes, Ms.
I
Gums.
just have a comment because I'm amazed always. I just want to applaud all of you because you lift each other up. You don't like say, I did this and I did that. And thank you for all the work you guys do. And in specific, how you're talking about your teams and the community groups. And I think that's super important to acknowledge that for this purpose. And I'm amazed by it. So thank you.
I think we all feel the same about that. Thank you. Thank you. So can I have a move and a second for supporting National Public Health Week?
Juby move.
Tarver seconds.
Okay, Juby and Tarver. Clerk, please call the roll.
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Yes,
passes.
okay. It was a lot of work there.
Yeah, I used 3 months worth of resolutions up this month, probably, right?
All comes at once. Okay. And now we have our animal control reports.
Good morning, everyone. I just want to start with House Bill 1533, that's 1533. It's the banning of declawing of cats that is currently in the Rules Committee. It was brought forward by one of our local representative, Barbara Hernandez. I just want to make sure everybody has this on their radar so they know it's coming forward. And it's actually going to ban non-necessary declaws of cats. So it's kind of important. Illinois has some great animal control laws. It's one of the things I love about Illinois. One of the things I love about working in this industry in Illinois is we are always at the forefront of the animal laws. And this is another great one coming forward. So I just wanted to make sure that that was up on everybody's radar. The other thing we're very excited about, Blair, could you pull up? Thank you. We have our first half of dates out for our vaccine clinic. We're very excited about this. This is our yearly rabies and microchipping clinic. Our April, May, and June dates have already been set, with our first one coming up Saturday, April 15th. We're very excited about these. We do these every year. They're very popular, especially among the senior communities and the people that don't have the ability to always go to a veterinarian to pay lots of money. The dog you'll actually see we use, that is Potato. Potato came to us through a hoarding case. This is 6 pounds lighter. You'll see how much happier she is in this picture. She lost a fourth of her weight with us before getting adopted. She was adopted 2 months ago and she's living a great life. Her owner still brings her in to see us all the time and has still continued with her weight loss. Hopefully, as we get a little closer to June, we'll come out with the rest of the dates. The reason we do them in stages like this is our county veterinarian, Dr. Davis, is the head of Aurora University. We also have a secondary vet, Dr. Jeff Weiser. Sometimes planning so far down the road is a little difficult for him, but we want to make sure at the beginning of the year we get these dates out as soon as possible because we already have people calling nonstop for them. We've already reached out to a lot of the senior groups to get these flyers into their hands. So it's very important that we get these dates out as soon as possible to everyone. That's all I had for this month. If anybody has questions for me, please let me know.
Yes, Ms. Juby?
I have a question. I'm sorry, I seem to be asking a lot. I know that when I used to live in Cook County, the Cook County used to reimburse spay and neutering through your veterinarian. Is that something that you guys ever considered doing, putting forth a little bit of money to help people spay and neuter their pets?
We don't have the funds that Cook County does.
Okay.
Cook County has around $7 to $8 million and they don't run a shelter.
Okay.
We do run a shelter. We do handle straying animals. So it's a little bit different in our
Okay.
situation. Our budget is
No,
nowhere
no,
close to
that's
theirs.
okay. I didn't know if that was
Oh, no, no,
something.
just explaining. Yeah,
Okay, great, super. Thank you.
of course.
Any other questions?
Madam Chair, Silva.
Yes, Dr. Silva?
Director Youngstead, I would like to learn a little bit more about the terminology, which I think is super important. Is there an official or unofficial definition, or what would you consider a high kill shelter?
Oh.
And you don't have to respond today. You can, we can talk about this. So yes, it's on pause. So I'd like to know a little bit more about how we dispose of our animals and how we unfortunately kill our animals. So a little bit more about that process, because it is uncomfortable to talk about, but I am a huge animal lover. So I think we have to look at the reality of things and just a conversation on that maybe in the future.
Oh, I'm always ready for these conversations. You'll notice on my monthly statistics, the way I put them out to everybody, it actually defines how the animals are euthanized at our facility under reasons for euthanasia. And that's why it's so important that this is put forward every month. We actually find there's a group out of New York called Maddie's Fund, and they actually started defining how euthanasias occur. They put it into 5 levels. It's healthy, sick treatable, sick untreatable, behavior treatable, and behavior untreatable. I don't like the definition of healthy. Shelters out there that are the quote unquote high kill are not euthanizing just because an animal's healthy. They're euthanizing because they don't have the resources. And that's where that healthy euthanasia statistic comes in, which is why I have the definition of healthy resources. We are very thankful here in Kane County. We have a very low euthanasia rate, and we're very proud of that. It used to be classified by Maddie's definition that 20% of your population and under, you can be classified as no kill. Animal controls throughout the nations got angry at this because that put us in a bad position where it is our job to protect the public safety and protect disease. So highly aggressive animals and very sick animals, that is our job to be taking them off the street sort of thing. So Maddie's Fund actually redefined that definition to say, as long as you are euthanizing the untreatable behaviors, the untreatable sickness, you can quote unquote classify yourself as no kill. I don't like the term no kill because when you go around asking people what no kill means, everybody means you don't euthanize. Well, unfortunately, that isn't the way it works. And a lot of these shelters that classify themselves as no kill do euthanize. A very low percentage. But again, they're euthanizing the animals that are extremely sick and extremely aggressive in nature. And that's what we should be doing in this industry. Our job is to protect and ensure that the animals that are going back into the public are good citizens of the public. That's why, like in our shelter, we're very big on enrichment. We have music playing throughout the shelter. We have an enrichment schedule. We follow through with all the dogs and all the cats. And every week that enrichment schedule is changing to stimulate them mentally, physically, and especially through their nose, because dogs, a lot of their emotion and everything comes through their smelling. So we're classified as a very low kill because I don't like the definition of no kill. DuPage, a lot of our shelters in this local area strive for that. And hopefully that answers your question. But if you want to go into more depth, I'm more than happy to.
No, it does. I wanted your opinion as your subjectivity as to where we lie on the spectrum. And I do understand that, you know, we do have a duty to protect and to serve our community. So that is very important. And some animals are beyond saving. So I do understand that we have to temper that. So thank you for the information. And it's exactly what I wanted.
Of course. And again, that is why I do make sure that that is put out every month, not only for this committee, but for the public, because everybody has a right to know what this county is doing. And I want to be as transparent as possible with everyone.
It is, and that is super important, but sometimes it's easier to vocalize things than it is to go back and read some of this. So the conversation is definitely appreciated. Thank you.
Thank you.
Okay, any other questions?
Madam Chair Combs.
Yes, Ms.
I
Combs.
apologize. I'm not on this committee, but I can't never shut up on this committee because I love it all. I just want to applaud you because you do link on your webpage for assistance with spay neuter. Also, you put the coyote information out. It's coyote mating season, FYI.
Yes.
Super important information for the public to know because they call 911 when they see a coyote, which is a pain in the butt. Also you, in your website, you add links for food pantry places, which is actually a huge request from not only our seniors, but a lot of folks are looking for that. And you add those links on there. So thank you for that work and everything you do.
Thank you. We also post to other low-cost shelters. We post to first aid classes you can take online through the Red Cross. And if anybody ever has a link in animals, we encourage you to please send it our way. We try to make our website as inclusive as possible because we try to draw so many people there. And from what we've heard to the public, when you Google animal stuff, our website is first to come up, which is wonderful. But we try to make it an all-inclusive website for the people of Kane County and for everyone else.
And you also, Gums, you also share that on social media, which is great. And then before you leave, I want to talk to you about that bill.
Of course.
Okay. Any other questions? Okay, we'd like to place those. Okay, any other business this morning? Any old business? Okay, and I'd like to have a move to place the reports on file.
I'd ask for unanimous consent to place reports on file.
Okay, Do I have
Sanchez.
Mr. Sanchez, thank you. Do we have unanimous consent?
Yes.
Yes.
Okay, thank you. And I don't think we have a need for an executive session this morning, but we do have a demonstration this morning. We have Nikki Franzen, who is going to show us something this morning. And as Dr. Isaacson, I
wish, yeah.
Mr. Isaacson was saying, February is Heart Health Month. And all month long, the county has been offering free CPR classes. And we'd like Nikki to give us an idea of what that's like.
Thank you guys for inviting me.
We need you to have a microphone.
Sorry,
Have a
I'm
handheld.
kind of quiet. We've taught a lot of classes this month, but I've been doing this for 18 years. So today I wanted to go over the AED with you guys because you guys do have one right outside your door for this room. In fact, Madam Chair came to CPR and a couple of you guys have come to my classes. Thank you.
Thank you.
So a couple of you.
Dawn, just hold it up to your mouth.
Real close.
Okay, this is where I don't do this a lot. So a couple of you guys have come to my CPR classes, but this month we put on 2 classes, like 6 to 7 classes a week, if not more, for the month of February. So since I started the coordinator position, we've taught 2,500 people in King County, and most of them are county employees.
Wow.
So Madam Chair did come the beginning of the month. So you guys only have one AED in this building for your whole building here, but we're working on getting more AEDs out there. So I wanted to show you guys how it worked, what we have for CPR, how we train, and then you guys are more than welcome to come to class or ask me any questions.
And if-
Sorry, I missed my class.
And if I may, I would encourage it. It was incredibly interesting. I learned a great deal. I'd not gone through such formal training before. And the reason I did it is because you never know.
That's right.
And now I have at least the knowledge that after I call 911 and they say, let me talk you through this. I have physical memory, muscle memory now of what it means. So that's the reason I did it.
And we normally do it on the floor. So I'm gonna do it on the table because it's easier, but make sure you always keep your elbows straight. Otherwise, you're not using your whole body to do this. So when you practice, I always have the iPad out for you guys to see. So when you guys do your chest compressions, you'll see that you go up and down the 2 inches and you have to stay, I'm not going fast enough. But you have to stay in between the grade, okay? Once your AED gets there, all you do is turn it on.
Okay.
Turn it up. Yes. Your pads look like this. You put them where they go. Once they're on, turn it on. It follow the prompts, okay? It'll say, don't touch him, preferably don't touch him. Before you guys shock, always say clear. So you have to hit the button in the middle. Okay? Everybody clear again, because if you shock yourself, don't call me,
We have a second emergency.
right? But as long as you guys can turn on an AED, it's gonna tell you what it can do. So all the pads that you have in your AED look like this. We do have a second set of pads that look like this. Okay? Certain situations, you guys do have to do stuff if they have like a medication patch or they're hairy or they're wet. So we do the quick wax job. But probably not the right comment, sorry. But it comes with a little bag that has scissors and a razor and a towel and gloves and everything in it. But this is all you guys have outside the store right here. We have an ambu bag in most of ours. We also have 4 doses of Narcan in most of our AEDs. I am working on getting more Narcan, but that's also part of the training. And plus we do baby CPR too. And then we go over choking. But we are working on getting another AED put on the 4th floor. I am actually going up there after this meeting. Question.
Any
just have a
questions?
question.
Yes, Ms. Judy?
So I didn't go through training, which I feel really bad for. Can you tell us really quickly how you would give Narcan?
Sure. So for these, it's you open the package. All you do is close off one nostril. You close off one nostril, you stick it up their other one, and you shoot it up there. You can administer it once every 2 to 3 minutes. If they're responsive, they'll come back and they're not very nice. If they're unresponsive, you can actually use the AED at the same time. An AED analyzes every 2 minutes. So you can do the Narcan every 2 minutes right before you shock them or no shock advice.
And there's enough in the dispenser to do multiple.
So this is a one and done,
Okay, so I'd need 2 of those if I was to,
sometimes more. So all of our AEDs have 4 doses.
okay,
All of the sheriff's office employees, the deputized guys, they actually have 4 in their squad, or if they have a dog, they have 8.
okay. So it's not unheard of that the first dose might not work.
Correct.
Okay, that's a good thing to know that you didn't do it wrong. It just maybe wasn't enough.
Correct.
Okay, thank you.
You're welcome.
It could take 2 or 3 or 4.
Or up to 7.
Is that, what is that? Is that I'm familiar with Flonase, for example. Is it like a
This is
mist?
Mr. Young speaking.
I need to do that. Mr. Young,
I will remind you until you
I
get it. It's
know.
okay.
4th time here. So, okay. Young speaking. I'm familiar with Flonase. Is that a very similar type? Is it a mist that goes into the nostril? Is that what that is?
Yes.
Okay.
And the way we train is we actually get expired Narcan, where you guys will Narcan the mannequins when you come to class and you learn about all the signs and symptoms. We train with it, how the guys do it, how the deputies do it on the road. And that usually you should put those in a biohazard container after you administer it. And then you guys just let me know when you use it and I replace your Narcan. But we're working on getting them with all the AEDs in the county. And right now we have about just over 100 out there. And we have 72 more going out to patrol.
Yes, Mr. Roth?
Roth here. I had a question. I think I know what it's used. It's when someone appears to be overdosed on drugs, you would use Narcan, or what's the reason? What?
So you would use it if they're overdosing.
Okay.
If they're unresponsive and you're not sure, use it.
Okay.
The only thing that'll happen is nothing will happen.
Right.
And all it does is stop the receptors in their brain that say, I'm high.
Thank you. I just wanted to confirm.
You're welcome.
Yes, Mr. Isaacson.
The health department does make naloxone available for free to anyone in the public who wants it. So any board members who would like it, we can make that available to you. It is available for free from the state, but we can manage all the shipping and receiving and get it out to you. This is something that we're trying, as Nikki said, we want it to be, unfortunately, it needs to be as common as AEDs, because you never know when you're going to be in a situation. And there is a lot of work, kind of back to the legislative things, around minors and naloxone. And on an email thread that we're on with our other partners around the state, there's been some discussion about that right now. Because certainly with minors, you want to be careful. It is a safe medication. It's not going to do anything to you if you don't need it. However, on this thread, unfortunately, we have too many people who have lost minors in their family to overdoses. So as people say, whoa, this sounds really dangerous, we shouldn't do this. Then people say, I lost my 16-year-old son, I lost my 15-year-old nephew. So naloxone is a really safe, effective way to save somebody's life. So we want to get it out to as many people as we can.
Yes, Ms. Bates?
Where's the schedule? State speaking, where can I find the schedule for all the classes you're teaching? Because I'm on the website and I'm not finding it easily. I thought I'd look for myself before I asked.
Director
I have,
Isaacson,
yeah.
can you help
Mr.
me
Kenyon
out?
has a copy of it in here.
Either I can email it to you.
Yes, Madam Chair.
Why, Nikki, why don't you send it to Jane Talish and then Jane can send it out to the full board?
Thank you, Madam Chairman.
And if we have, sorry.
No, go ahead.
If there isn't any spaces available, because we only have 2 days left after today, I will make it a point that we get you guys a class.
Thank you.
Because I am flexible. I'm working with people where we can do class in the morning, afternoon, or evenings.
Do you have a minimum or a maximum number for each class?
No, ma'am.
Okay. Ms. Juby?
So I have two things. First of all, could you bring it to us and do it here for us?
Yes.
So we could all like say, hey, we should get this done. So can we clear a whatever? I think that might be something we should look at. That would be really cool. Because I make it here apparently much easier than I make it anywhere else. I don't know why, it's just weird. But and then my second question is when you're storing the Narcan, it can't be in a car, right? It can't be in extreme temperatures.
It can't be in extreme heat or extreme cold.
Right.
Because the Narcan will freeze.
Okay.
So you don't want that. And then I'm not sure what the top temperature is, but I can find out for you.
Yeah, that might be something to know because like, I know for years I carried an EpiPen in my car. Well, that wasn't going to work, which I didn't know. So, yeah, if you could kind of get that information. And also, do you stock EpiPens in these as well? I mean, as long as we're talking emergency life-saving devices, are EpiPens included in that?
Not right now.
Okay.
Because I think we're working on the EpiPen thing, but all of our staff at the sheriff's office are CPR and first aid certified, where we're hoping to do a first aid class for everyone too.
Okay, great. Thank you.
You're welcome.
Yes.
And one comment on storage of naloxone. Obviously, it's a medication, so there's stated parameters for temperature that we want to follow. But there is some new research that's just come out, and I can share this article that shows it's actually effective even after it's been exposed.
Okay.
So just like expiration dates, we need to follow what's written down. But if you're ever in a situation where you're unsure and you have naloxone that may have been too cold or too hot or old, try it anyway, if that's all you have. So.
Also CPR, if we bring it here, it is about a 4-hour class. Because we'll train you the same way we train our deputized personnel. So if they come here, everybody across the board knows the same stuff.
Where do you give the training? Down in Aurora?
We do, we have one more training at the health department tomorrow. Otherwise, it'll be at the sheriff's office on 38.
Thank you.
You're welcome.
Any other questions?
Madam Chair Gums.
Yes, Ms. Gums.
I just debated my entire year with the addition of the naloxone and the AED. That's something that I am actively working on, getting them in every single AED across this entire country. So thank you. Like
Thank
you
you.
literally made my year.
Okay. Thank you very much. Thank you. Okay. So we can get some more information and then maybe get a class going for us and we'll all be qualified. Okay. So with that,
Madam
yes,
Chair.
Mr. Tepe.
Tepe here. I'd like to point out that next month's meeting is scheduled to be at 8 a.m. on the calendar.
Why?
I'm sorry, what?
Hello.
What?
And why is that? Do we know?
There'll be
No, it's
Human
only
error.
in one spot. It's not in the other spot.
Is Oh, it's only in one
It's a
place?
typo somewhere. I
Okay.
saw that too.
Next month's meeting will be at 9 o'clock so that we can all be here. So, okay, so with that, I'd like a move to adjourn.
Sanchez moves.
Thank you, Mr. Sanchez. Do I
Juby
have a second?
second.
I'm sorry, was that Ms. Juby?
I did do.
Okay,
I like this.
Oh, I thought you were.
all agree? Yes?
Yes.
I, okay. Thank you.